Okay, so you had your tooth out. Now it is time to heal. So I know we talked about this in the office, and we give you a piece of paper with all this information, but you know, when after the tooth's out, a lot of times people forget. So first, you want to just treat yourself kindly, okay? Just let your body heal. We removed part of you. So, you know, treat yourself, like I said, kindly. So typically, pain after the extraction is the worst around day 3. So what we're really going to want to do is keep the swelling down. By keeping swelling down, we keep pain down. Swelling is really what is causing pain after an extraction. So ice or frozen vegetables on the area but outside your cheek, 10 minutes on, 10 minutes off for the next 4 hours. Okay. And then whatever you take for a headache, whether it's Advil or Tylenol, and I would take that for 2 or 3 days straight. And that keeps the swelling down, so we kind of stay ahead of, you know, the pain. The other really, really important thing is preventing something called dry socket. Dry socket is when the blood clot that is in the site just dissolves and comes out before your soft tissue can heal over it. And it's really, really painful because your bone is just exposed to the air. So to prevent that, really important, no smoking, no vaping, no smoking marijuana, all those chemicals in those substances just eat away at the blood clot. So it's not just the inhaling, it's the chemicals in it. You also are going to want to rinse vigorously. If you have to spit, just kind of let it fall out of your mouth. And then, you know, no drinking through a straw either, because the straw can also dislodge that blood clot. You also are going to want to take it easy. We don't want to elevate your blood pressure because that also can dislodge the clot. So, you know, I'd try and hold off on working out for 2 or 3 days. You do want to keep that area clean, okay? So you can rinse your mouth out. If we gave you still a mouth rinse after every single meal, okay? So 3 times a day, but you can do it more if you'd like. It's not going to hurt you. Clean the area gently with a toothbrush, okay? But like I said, no rinsing vigorously. The other thing regarding bleeding, we would not have let you leave the office if you were bleeding. But you know, if you notice a little bit of oozing or a little bit of blood, bite down on some gauze that we gave you. If you notice it's a little bit more significant than you'd like, a tea bag, put in water and then put some pressure on it, that should really help stop it. If you feel like, oh, this is really more than I would expect, give our office the call if we're open, or shoot me a message over text, and you know, we'll be happy to help you out and answer any questions you have. Regarding pain, whatever you take for a headache is really best, but if you feel like your pain is kind of significant, they have found, studies have shown that 800 milligrams of ibuprofen with 1,000 milligrams of Tylenol is really the best for pain. It's shown to be more effective than a narcotic. So go ahead and take that if you feel like you really need to, if your pain is kind of significant. And once again, we're here for you. So we've given you written instructions. You have my cell phone number. The office is open till 5 most days during the week. So just give us a call. Thanks.